అందరికీ నమస్కారం. ఈ రోజు మన TAGCA తెలుగు అసోసియేషన్ ఆఫ్ గ్రేటర్ షార్లట్ ఏరియా వారు గత 3 వారాలుగా రన్ చేస్తున్న కోవిడ్ ఇన్ఫర్మేషనల్ Q&A వెబినార్ సిరీస్ కి స్వాగతం. ఈ రోజు this is the fourth of our series of informational webinar on COVID-19 by a group of volunteer physicians of TAGCA. సో ఈ రోజు మన గెస్ట్ స్పీకర్స్ ముగ్గురు ఫిజిషియన్స్ అండి. One physician will be joining us in a little bit. Right now, we have Dr. Aruna Pedireddy, as all of you are well aware of. She conducted our first COVID-19 webinar, and she's in internal medicine, primary care. And then we have Dr. Anupama Nilakanta, who moved in from Michigan, and she's a specialist in infectious diseases in the area with about 8 years of experience, and she has given us our time today. So we will also have Dr. Anupama Gotimukla, who is a pediatric anesthesiologist and also the vice president of API, American Association of Physicians of Indian Origin. She will be joining us soon within the call. As we have done earlier, ఇది 2 భాగాలుగా మనం విభజించున్నాము. మొదటి భాగంలో వైద్యులు ఒకరి తర్వాత ఒకరు వారి స్పెషాలిటీస్ లో ఈ ఇన్ఫర్మేషన్ వెబినార్ లో COVID-19 గురించి ఇన్ఫర్మేషన్ ఇస్తారు. వారి స్లైడ్స్ లో వారు డీటెయిల్స్ లోకి వెళ్ళి వారి స్పెషాలిటీని కవర్ చేస్తారు. ఇప్పుడున్న పరిస్థితులు వాటిని ఎలా ఎదుర్కోవాలి అన్న ఒక ఇన్ఫర్మేషన్ ప్రొవైడ్ చేస్తారు. అండ్ ఆఫ్టర్ దట్ రెండవ భాగంలోకి వెళ్ళేటప్పటికి we will open it up for question and answer. This is on general information about COVID-19. ప్రశ్నలు జవాబులు అన్నది నేను అనౌన్స్ చేస్తాను. అనౌన్స్ చేసినప్పుడు we will open it up and I will announce all the details of how you can call in. మీరు చాట్ ద్వారా కానీ ఎలా అన్న పద్ధతి నేను వివరిస్తాను. ఆ వివరణ అయిన తర్వాత then we will go for question and answer. So part 1 లో మనం ఇప్పుడు we will open up for the speaker to start in this TAGCA webinar. This is the last of our series, and it will be supported by informational videos in the future by physicians. And I will give it to Dr. Anupama Nilakanta, specialist in infectious diseases. Namaste Anupama garu. Thank you very much and for helping us and giving us your valuable time. She will be walking you through her slides and information in this webinar. Anupama garu.
Namaste, and thank you for giving me the opportunity to participate and share my experience. So again, whatever I am sharing is purely my personal opinion, and I just want to, my specialty is infectious disease, but I also have a degree in master's in public health. And so I specialize in hospital epidemiology in trying to help prevent infections in the hospital and outbreak management. So previously, last 3 webinars lo chala mattuku coronavirus gurinchi they've already spoken about it. So I'm going to be a little brief and touch on some topics which have not been talked about before. So I think as we already know, coronavirus is a family of virus which causes common cold. It can cause infections throughout the year. Kinda 4 types of commonly seen coronaviruses which cause common cold is mentioned over there, and usually those can be identified in tests which are done routinely in the hospital. So it can the incubation period is generally 2 to 14 days, and what that means is once you are exposed to the virus, you can take anywhere from 2 to 14 days for you to show signs or symptoms of that virus. So this from here, what we currently have is a novel coronavirus, which is COVID-19, which basically has come from a mutation, probably from an animal source. On the next slide, please. So as we can see, when we have animal viruses which have mutated and come into the human population, humans don't really have any pre-existing protection. So it's really easy to spread the virus in that instance. So Anduke, it has pandemic potential. The last pandemic potential, which was big, was in the Spanish flu in 1918. And we also had some smaller pandemics in 2009 and previous SARS-1 outbreak. So here bats and this anteater-like animal, the pangolin, is thought to be intermediary host. The first cases was in December and was traced to a wet market in China. On the next slide, please. So currently, where are we? As of yesterday, we've had greater than 2.8 million cases worldwide with over 200,000 deaths. In US, we've got close to 1 million cases, around 53,000 deaths. And in North Carolina, specifically around 8,000 cases with 269 deaths. And also across India, we've had around 25,000 cases. On the next slide, just showing cases per 100,000 population. So as you can see, even though we have done a lot of tests in America, we've had greater than 4 million cases tests done. As you can see, the amount, when you look at cases per 100,000 population, we are lower compared to some other countries such as Spain and Italy, as you can see. And also on the next slide, looking at deaths per 100,000. So even though we may have a lot of cases and are the leading country with the highest number of cases across the world, as you can say, our death rates haven't been as high as what it has been in other countries. Again, the death rate varies between each country, and it is based on the amount of tests done. And so the denominator, which basically the more you test and identify patients who are asymptomatic and lower, you will basically your death rate will depend on some part of it will depend on that too. Next slide, please. So this is just some clinical features. So again, COVID-19 can be similar to all other respiratory viruses such as influenza, and sometimes it is indistinguishable. So you can have fever is present in almost 80 to 90% of patients, and along with that, other influenza-like illness symptoms such as cough, shortness of breath, myalgias, runny nose are some of the symptoms which are commonly seen, and you cannot distinguish this between influenza versus other viruses commonly seen such as metapneumovirus and all of that. There are some clinical characteristics which is somewhat more unique to COVID-19, like loss of smell and taste, which could be the only presenting feature. We've also seen some GI symptoms like diarrhea, which could occur in the initial stages of this disease compared to later. And also, these patients are at a risk for stroke and cardiac complications because there is thought to be some hypercoagulable state. So what that means, your blood is, it has a potential to become thicker and cause thrombosis. So there has been some complications associated with that. So the R naught for COVID-19 is around 1.4 to 4 with an average of around 2. And what that means is when one patient has the disease, they have the capability of infecting 2 other patients who are not immune to it. So this is different for different diseases. For example, diseases like measles, the R naught is around 12 to 14. So what that means is one person can infect a lot of people. It's not as high for COVID-19, which is good for us, but it still means that there is some amount of transmissibility. Again, 80% of symptoms are mild symptoms, and you don't need hospitalization and can be treated at home. And most people recover without any issues. 15% do have severe disease and has to be hospitalized and can develop pneumonias. And the last 5% are those who become very critically ill and need ICU care and on the ventilator. These patients are the ones who have the maximum mortality and morbidity. And these are the ones who we are trying to protect as much as possible. Again, there's a lot of, there is some data of late which is in children, and Dr. Gotimukala will be covering that later. But again, children are less impacted compared to adults. Next slide, please. So this is the transmission of SARS-CoV-2, where it's mainly droplet precautions, which is 3 to 6 feet. Whenever anybody coughs or sneezes, so what happens is all these particles which are coming out of your sneeze or your cough, or even when you normally talk, it is sprayed into the ground, and larger droplets kind of fall to the ground, whereas the smaller ones basically can become airborne and cause disease. Now, a lot of those who are in closest contact with with individuals are the ones who are more prone. There's also some thought of having viral detection in stool, and so, but it's not known to be transmitted via fecal-oral mouth. That's not the main transmission. Next slide, please. So whenever somebody gets ill with this disease, usually once you have your fever has gone away, you might think that you are completely ill and you wouldn't transmit anymore. But what we have seen is that even after you have gotten better, where you are afebrile, you could transmit the virus in your nose for a period of time. Currently, we have seen patients who have a positive PCR, and what that means is it just could be dead virus or living virus up until almost 3 weeks after you have gotten better. So there has been small studies looking at viral cultures, and those have shown that you could be positive with a viral culture for at least 8 days after your symptom onset. So when you fall sick, make sure that you actually you isolate yourself until you are completely fine with no fever or respiratory symptoms, at least for a period of 7 days. Next slide, please. So I just want to go over a little bit about testing for COVID. A lot of changes have occurred over the past month or so in the United States. There are a couple of different types of tests available for testing. So the first one is the PCR-based test, which is the most commonly used test and available all over in commercial labs and individual labs. This is the test which, again, CDC and WHO had also kind of put out. It has a high sensitivity, but there is a small amount of false negatives too. And what that means is when you have a positive test, most often it detects, when you are sick, it shows that you have a positive test. It is a true positive. Occasionally, when you are sick, you still might have a negative test. And based on your clinical picture, your doctors will determine if you need repeat testing in that instance. There are also other tests called antigen-based rapid tests, and these tests are very, the results are available based on the type of lab. The results are available within 3 to 15 minutes, and it's rapid. But then the problems with that is that even though you may have the virus, it might not, it might show that it is a negative, and so that what we call as a low sensitivity of the test. So it's really, so again, your doctors will take into account clinical pictures when they are determining the utility of these tests. Also, viral.
As we wait for Dr. Anupama to come back, we are going to, we also have been joined by Dr. Anupama Gautamutla. She has also joined us in the webinar that we are conducting today. We're right now on the slide for testing for COVID, and Dr. Anupama was talking about PCR-based tests, and I think we have a small technical difficulty there.
We'll just wait for her to be back.
Yes. So in the meanwhile, I would like to, have Dr. Arna Pedreddi take this and talk about, COVID-19. A few words as and when Dr. Neelakanta joins us back, we will have her screen share start off where we left.
Namaskaram andi. Andariki namaskaram. So na peru Aruna Pedreddi. Meeru choose untaru kontamandi, meelo kontamandi. First webinar chesanu. And so nenu internal medicine primary care physician ni. Gata 5 సంవత్సరాల నుంచి షార్లట్ లో ఉన్నాము. 15 years నుంచి ప్రాక్టీస్ లో ఉన్నాను. సో గత 3 వారాలు, ఇది 4వ వారము COVID-19 వెబినార్స్ చాలా సక్సెస్ఫుల్ గా జరిగాయి మీ అందరి వలన. సో డాక్టర్ అనుపమ గారు వచ్చినట్టున్నారండి, రూపా గారు.
Yes.
Sorry, my computer stopped suddenly.
No problem. Welcome back. And I can also introduce Dr. Anupama Gautamutla, who has joined us. She is a pediatric anesthesiologist and the vice president of RP, as I mentioned earlier. Namaskaram andi. So now we will continue with Dr. Neelakanta. If you want to go to the screen share and start off from where we start. And
Okay, so again, viral culture is something which we have seen only, they are specifically using for research purposes. And the other test which could be really useful is serology. Next slide, please. So what serology means is that whenever we get the disease, our body responds to it by producing antibodies. Initially, you will get something called IgM antibodies, which is the acute phase antibodies, which shows that recently you have gotten this disease. After a few days, when the IgM kind of is produced, IgG antibodies are developed, and what that means is that you probably have gained immunity for this disease, and you could have, it can take a few days for it to develop. There are a few FDA available approved tests which are available. So typically this is not useful in the hospital setting, but then these serological tests are used for several different, in several different ways. Some of it is like cluster tracing in some countries, like when there is a few positive cases, they try to do serology around for other close contacts to see if they've developed disease or not without having the positive test. Also, they look at it to see what the herd immunity is. Herd immunity means the percent of population which is immune to the disease. Again, that is important for different diseases. So for a disease like measles, you would want to have a herd immunity of over 90% if you want to protect the really few people who cannot develop immunity, like very young children or very old people with multiple comorbid conditions. Those patients do not typically respond to antibodies really well. They don't, and so they are at higher risk for complications. For diseases like influenza, the herd immunity is somewhere around 60%, which is needed to at least have some sort of protection in the population. Now for COVID-19, we really don't know what that herd immunity needs to be to protect our population. So that's something which is yet to be learned when we have robust serological tests. Also, the other place where this can play a role is for healthcare workers, where you, if you have healthcare workers who have antibodies, you know they are immune to it, so they potentially could take care of patients who are positive for COVID-19. And the next one is plasma therapy. So, so again, serological tests can be used in a wide variety of ways, and we are still in the initial stages of trying to figure out how best to make use of it. Also, in some countries like China, where their cases have plateaued off, there is some question about reinfection. And again, it's yet to see, depending on your whether it is truly reinfection or a relapse of infection. And again, serological tests can kind of help differentiate some of that as we go on into this epidemic. Next slide, please. So again, there's no real treatment which has been of proven efficacy for COVID so far. Again, for all mild self-limiting disease where you can take care of yourself in the house, you don't really need any treatment. You will continue to take regular symptomatic treatment, and what that means is regular medications to reduce your fever. Tylenol is the preferred agent, acetaminophen, and there has been some studies like NSAIDs can increase complications. It has not been proven. If you are someone where Tylenol does not work for your fever, you can go ahead and take NSAIDs as needed. And also make sure you hydrate yourself well and keep away from everybody else in order to prevent your disease from others. That's the main important part, because when you have symptoms, your viral burden is much higher, and so you have a potential to spread it much easier than when you're asymptomatic. In the hospital, we have several different drugs which are being used. Now, none of them have had proven efficacy. Again, chloroquine, hydroxychloroquine, something which we frequently use for malaria. Almost every week there is new data coming out. So we aren't 100% sure which of these medications that I've listed over there actually help. There are some very small case series for each of these which say that it could help. And so there's a lot of clinical trials across the country being utilized, and so whenever patients are on these medications, hopefully the hospital, most hospitals are using them in a fashion with where they are enrolling them in clinical trials so that we can get more information as to the utility of these drugs. The other thing is convalescent serum, which is free. And what this is once you have had COVID-19 infection and you have completely recovered from it, greater than 2 weeks out from the disease, as I said, mentioned earlier, that you have antibodies developed in you. And if your antibody levels are at a certain level, then you could potentially, your serum could be used to give it to other patients who are really ill and to help fight that disease. So again, this has to go through your local blood bank or Red Cross or One Blood or any of it, depending on which area you are. So if you have had the disease and if you are interested, definitely please call your local blood bank to see if you're eligible for to help somebody else who is in need for this. Next slide, please. So this is just the WHO pandemic phases, and as you can see, we are somewhere in the middle over here with phases 5 and 6 in a full-blown pandemic with widespread human infection in all regions. Now, what comes after that? So once we have really done well with social distancing and we have flattened the curve so as to not overburden our hospitals, because in the learning phase, because we were still trying to figure out what this disease is doing and all of that. Now in most of the areas, especially in North Carolina, our peak has significantly been pushed, and it is more towards end of May, early June, and we might not even see the peak that we actually anticipated before. So when we start reopening things in a phased approach, and there is the social distancing starts to decrease, then you probably will see a second curve, which is called post-pandemic curve. And that basically, you would want to try to prevent peaks in that also. And this will happen until you actually, until you have the virus in endemic levels in your community, circulating in your community. Next slide, please. So again, I think over the past 1 to 2 months, there has been a lot of help from everybody in trying to flatten the curve and all of that. And now I think a lot of places have started talking about how to re-entry and how do you actually go back to being normal, which again, it cannot go back to being pre-COVID levels, but then at least making sure what is a safe way of going back to what you would call your new normal. So there is a White House plan also which has been published, which is basically a phased approach, which looks at number of patients with influenza-like symptoms and also cases in your state, and based on your testing availability and all of that, taking all that into consideration, you would still want the vulnerable population, which is elderly, those with comorbid conditions like diabetes, hypertension, cardiovascular disease, and very young children. They would still need to shelter in place because they are the ones who are at the highest risk of complications. Again, avoid socializing in groups of greater than 10 and wearing a mask in public at all times. The use of the mask is, again, you would want to protect your secretions, contain your secretions and prevent it from spreading to others. Again, I think for employers, even if as companies open up, they have talked about return to work in phases and also encourage telework. And again, no opening of areas like cafeterias and areas where there's a lot of collaboration and things like that, because you still want to maintain that social distancing in a safe manner. Again, schools and camps in phase 1 would still be closed. Gym and theater also there could be open, but again, in a manner where social distancing. And I think some facilities have also looked at when you are coming in, screening patients on a symptom check, etc. Like, for example, for hospitals, most hospitals now, for any visitors are restricted, but then even if they have to visit, they usually screen in some sort, either with temperature screening or with influenza-like illness symptom screening or something like that. So, and again, elective surgeries and all of that also can resume in phase 1. So once all these are put into place, you would want to look at what that does to your cases and your influenza-like symptoms numbers. And then based on that, you can move on to phase 2 and 3 to ongoing relaxation of these rules. and relaxation of these rules. Next slide, please. So again, in hospitals also, we've been talking a lot about phased approach of opening up things in the hospital. So again, when COVID era hit, I think a lot of only emergency surgeries were being performed. All the others were pretty much not put on hold. Now, there are a few things which is semi-urgent or urgent, which can be put on hold for 1 to 2 months, but it cannot be continued to be on hold, because then it would become an emergency procedure. So again, doing it in a very educated manner on what to open up first kind of is what some of the hospitals have been dealing with. Again, resuming cares in clinic and following social distancing in waiting rooms, making sure you have your mask on when you are in the waiting room between other patients, trying to maintain that 6 feet distance from other individuals when in public. Also, I think in this COVID pandemic, a lot of hospitals have done really well with telemedicine and virtual care. Again, in the Charlotte area, the 2 big health systems over here, Novant and Atrium, both of them have virtual care capabilities. If you go to their websites, you can actually book an appointment, and it's fairly easy to go and request an appointment from the comfort of your home. And if you do have to see a provider once they have evaluated you, then you can go to, then they will appropriately triage you and send you to where you need to go, whether it's your office or urgent care or ER. And again, if there's any emergency, of course, the hospitals are always open and EDs are always open. Next question, please. Next slide, please. So what do we expect? So again, COVID vaccine, it takes, usually vaccine development occurs in 4 phases. The first phase is when you're looking at very small studies, around 40 to 50 people, where you look at safety and immune response of the vaccine. Phase 2 is when you have larger studies where you again inject the vaccine into humans and look at efficacy and some side effect profile too. And typically, only after the phase 3 trials, which is when hundreds of patients have received the vaccine and you deem it to be efficacious, that it is useful that you give it to everyone, and there is a reasonable safety profile, only then it is typically approved by governing bodies such as FDA for all countries. And sometimes in phase 4, you also have post-surveillance monitoring for adverse effects, some of the rare adverse effects like Guillain-Barré syndrome and things like that, which occurs very rarely. Those are something which is looked into in phase 4 trials. So as you can see, all this takes time, and we are quite far off from a vaccine right now. There are some vaccines in different countries in phase 1 and very few in phase 2 trials. So at least for us to get a vaccine which is approved will be another year at least at the best. And once it's approved also, again, the number of doses which are needed, as you can imagine, it's a pandemic across the world. So it will take time for it to get to the general population. So again, as we reopen, I think as we reopen this, it basically means like being very cautious, making sure we do our best. If you are sick, definitely do not move out and reduce your amount of spread, and try to build that herd immunity in a controlled manner is what we are trying to do. I think I'm done with my, my part of the presentation, and we can take questions later. Hand it over.
Thank you, Anupama Garu. That was a wonderful slide information and a lot of information as far as COVID-19 and infectious diseases covering COVID-19, about the pandemic and how it affects us is concerned. So next, after this, we will go with the next physician who will be Madam Anupama Garu. You want to take the next one, or I think for the slideshow we are ready with Dr. Aruna. So Aruna Pedreddi Garu will now take this forward. Aruna Garu.
Thank you, Andy. అందరికీ నమస్కారం. అగైన్ నేను డాక్టర్ అరుణ పెద్దిరెడ్డి. మీరు ఇంతకు ముందు నా వెబినార్ చూసే ఉంటారు కొంతమంది. ఫస్ట్ వెబినార్ చేశాము. సో TAGCA వారు నిర్వహించే ఈ COVID-19 ఇన్ఫర్మేషనల్ వెబినార్, ఇది 4th. దీనికి వచ్చిన మీ అందరికీ స్వాగతం. సో అండ్ దెన్ ఆల్సో మీరు పార్టిసిపేట్ చేసినందుకు మా దగ్గర నుండి అండ్ TAGCA వారి దగ్గర నుంచి కూడా చాలా థ్యాంక్స్. సో ఇప్పటికే చాలా COVID-19 గురించి ఇన్ఫర్మేషన్ మీకు తెలిసే ఉంటుంది ఈ వెబినార్స్ ద్వారా కానీ, బయట న్యూస్ కానీ, సోషల్ మీడియా కానీ. సో ఈ రోజు ఏంటంటే బ్రీఫ్ గా వెళ్తాను. డాక్టర్ అనుపమ గారు యాక్చువల్ గా చాలా ఇన్ఫర్మేషన్ ఇచ్చారు, చాలా డెప్త్ ఇన్ఫర్మేషన్. So I'll go briefly. Some of these were covered in the first webinar, but I want to stress again some of the things, especially prevention and how to stop the spread. So those two are the most important things at this time. So like before, Malli slides share చేస్తానండి. So as we are hearing on the news every day, right? In United States, like actually we are reaching like close to 1 million cases and the deaths are more than 50,000. So as we all know, most common symptoms are fever, fatigue, dry cough, shortness of breath. But as Anupama said, these are the most common symptoms, but it doesn't need to be on every patient, because we are seeing in the hospital, some patients are coming with just with GI symptoms, like diarrhea. Some patients come with just heart failure. There are certain group of patients like who may not have any symptoms. One of my patients went to the hospital, she had just a fracture because she fell and she was positive for COVID-19. So but we are here saying like what are the most common symptoms. And we also have to be very careful with people. Like it's not only us getting infected, we also have to think about people who are around us. So I'm just focusing again on high risk people. Any people who have chronic medical conditions, like say it's asthma or heart problems or diabetes, lung conditions, even just being old age, more than 65 years old, dialysis patients, transplant patients, and who are on immunosuppressive medications. These are all at very high risk. So if you have any family members in your family, you have to be extra careful, because you're not bringing anything. It can be avoided for them. So, and then the other thing is also smokers are also increased risk, they're saying. So it's also time to quit smoking if anybody is smoking. So how we spread, we also know like it takes, the incubation period is 2 to 14 days. So that means you can have COVID-19 and you may not have symptoms for 2 to 14 days. And it's basically spread from person to person through droplet, as we mentioned before, cough, sneeze, our breathing, when we breathe out, or sometimes even with talking. So all of these things that we are like bringing out these droplets outside, which the virus is in the droplets. So either they can be in the air or they can fall into the objects or surfaces, depending on the size of the droplets. So that's the basic mode of transmission. As we said, there is a small number of people who may not have symptoms. So how do we stop? Again, the same thing I'm stressing, hand washing, cover your coughs and sneezes, and avoid touching your face, especially mouth, nose, and eyes. And also any like frequently touched surfaces, like disinfect, and try to stay home and keep distancing, social distancing. These are all very important still, no matter how much we are changing the guidelines, these are the same. So prevention, what's the best way of preventing? Better thing is don't let the virus come to you or close to you. So clean your hands frequently with soap and water, as we know, at least for 20 seconds, minimum of 20 seconds. So if suppose you're in a situation that where you don't have soap and water, at least then you can use the hand sanitizer. It should have at least 60% of the alcohol in it. So, and avoid close contact and maintain the social distance. And you need to stay home if you're sick. Sick means like if you have any respiratory symptoms or running fever, and cover your coughs and sneezes again, and wear a face mask, especially if you're sick. So we talked about this also before, cleaning and disinfecting the surfaces that are dirty and that we are using commonly. So there is also EPA registered household disinfectants and bleach. If there is a soft surfaces like carpet, you can do with wash with soap and water. And electronics we use every day, you can use a wipeable cover, and you can clean with alcohol base, at least 70% of alcohol in it. And laundry, at least use the warmest appropriate water setting. So social distancing, as you know, we have been following social distancing almost everywhere in the United States, and we know what it has done so far. We are able to at least, coming to the, curve is a little bit better with social distancing. I mean, we still have to do much better, but we know it is effective. So please continue to do the social distancing at least 6 feet, and do not gather in groups, at least more than 10 people. And stay out of crowded places and avoid mass gatherings. And social distancing is very important, especially for people who are at high risk, as we mentioned before. And even going to the pharmacies, sometimes we cannot avoid these things, going to the pharmacy or grocery store. We do have alternate options, so please utilize that. Either you can order a mail order medication, order the groceries online. If you are not able to do that, wear mask and keep away from people. Don't go into the crowded places. So I want to, give few slides about the face mask, especially the cloth mask, because CDC is recommending now to wear a cloth mask when you go to a public place. Because a lot of times we are not able to maintain social distance, but still we have to maintain social distance even with the face mask. So it should not be placed, you can't put the cloth mask on everybody. No, don't put on people who are under 2 years old and who have any breathing troubles, and if people are unconscious, and who needs like assistance with the, cloth mask. So how to wear a cloth mask? Make sure the cloth mask, it comfortably against your face. It should not have any gap in it. So make sure you securely tie the ear lobes, and there are multiple layers of fabric is better. It should allow breathing without any uncomfort. So you should be able to wash it in the laundry without damaging it. So these are the important things for using a cloth face mask. So you can make cloth, as we see, a lot of people are making in their houses and they're donating. We are seeing tons of cloth masks are donated to hospitals, which is the great thing the public is doing. So we can do from household items, like common materials, which do not cost too much. So I think this is covered already. So the cloth face coverings recommended, they're not surgical masks, and they're not also N95s. So these supplies are getting better to the healthcare providers, but they're still low. So these are restricted at this time to only healthcare providers. So it's not recommended to use by the public at this time. So how to clean cloth mask? Washing machine should be enough to properly wash the face mask. So also one more thing is, when you're wearing the cloth mask and you go to a public or something, when you take it out, be careful, because don't touch your eyes, nose when you're removing the face mask. So I just have a few slides if anybody interested, how to make the cloth mask. These are recommended by the CDC. So you can use these materials, 10 by 6. I have a picture. So you just fold it and you attach these strings and you put these 2 layers. So this is one simple way of making mask. And the other thing they're also suggesting is you can use like as simple as a t-shirt. This doesn't even need any stitching. So this you can make like this, so you can tie it. And then bandanas, you can also use this. This also doesn't need any stitching. You use like 2 hair ties. You fold it and you put 2 hair ties, and then you can use it if you need it, like, immediately. This is the simple one. So the other question a lot of people have is like kids. Kids are doing a great job, I think, because since last 1 month, it's hard for them to stay home. Schools are closed and they can't do anything. So they might get relaxed a little bit, and people want to go to the recreational parks, but be careful. So there are some do's and don'ts I'm attaching here. So go to the parks that is very close to your home, and you prepare before. I'm sorry, there is some error here. And still maintain 6 feet away from other people. Even it doesn't matter, it's your close friends or somebody who you know very well, it doesn't matter, but you have to maintain 6 feet distance. And also face masks. So even, I don't think the swimming pools are open, public swimming pools. So anywhere you have to keep the distance. So what the things you're not supposed to do? If you are sick or were recently exposed to COVID-19, please do not go. Do not visit crowded parks, hot tubs, spas, water, any activities with water, playgrounds or water parks. So other thing I would like to cover is a lot of people, I think in previous webinars, were asking about, animals, whether the animals are going to get this or whether we are going to get from animals. So we have to follow the same precautions we are following even when animals are around. So we have some cases that animals were also infected with COVID-19, but we are not sure completely at this time how the transmission from the animals to the humans. There is a possibility. So do not let pets interact with people or other animals outside of the household. Keep cats indoor when possible to prevent them from interacting with other animals. You can walk the dogs on a leash, but maintain 6 feet distance, and avoid dog parks or public places where a large number of people are there. So if you are sick, suppose, let another member of your family take care of your pet. And also avoid contact with pet, including petting, snuggle, and all that kind of stuff for the other animals that are not your pets. All right, so stay healthy around animals, wash your hands after handling animals, their food, waste, practice good pet hygiene, and clean after pets properly. And if you have any questions that your pet is having any symptoms, please talk to your vet. And so children that 5 years of age or younger, and people 65 or age, we know that these two groups of people can easily get germs from animals anyway. So international travel, a few things, if somebody had traveled internationally and they came back home, still recommending to stay home for 14 days and monitor your symptoms. So monitor your temperature, make sure if you are getting any symptoms of cough or shortness of breath, please talk to your doctor. And also avoid taking public transportation like taxis or ride shares. And also keep your distance, of course. So how to get tested? It's not like everybody needs testing at this time. The testing is still not enough supplies. So what they're recommending is those people, there are some criteria for the testing. So those people who meets the criteria only, they can be offered testing. So you can speak to your healthcare provider. If somebody has symptoms like cough, shortness of breath, and they had a close contact with a confirmed case of COVID-19, they are eligible for testing. And if somebody have lower upper respiratory symptoms and they also had a flu test which was negative, they may be considered to have a test. And you can either talk to your primary care provider, or you can visit your state or local health departments also to get more information on where to get the testing. So suppose if you get tested and if you're negative for COVID-19, either you're not infected at this time when the test is done. It doesn't mean like you will not get sick. You may be early, when the test is done, you may be too early to be positive, or you may be negative, or you can get exposed again. So monitor carefully, and because your test is negative, don't take it easy and you can go anywhere, without maintaining social distance. You still have to be careful and follow all the precautions. So suppose if your test is positive, there are certain things, as Dr. Anupama Garu said, like not everybody will be in the hospital. A lot of people, about 80 to 85% of the people who are positive for COVID-19, they can still be managed at home with the symptomatic treatment, with isolation, hand washing, distancing, try not to spread to other people. That's the most important thing if somebody is positive. So most of the times you can recover good and you don't need hospitalization. But if you're having any warning signs like breathing trouble or, those kind of things, you do call your doctor or you visit the emergency room. So these are some of the things, you try to use your own bathroom, cleaning supplies, you wash your own dishes and utensils completely separately with hot water, and also your trash, because keep it separate, and you also laundry your clothes separately with hot water. These are the very important measures you have to take when you are positive, especially if you have your family members, even a person like a mother or father at home who are at high risk. So be careful. So these are the emergency warning signs: trouble breathing, persistent chest pain, or if you're confused, or if you notice somebody confused in your family who are positive, blue lips or face. These are the things you have to call 911. So how is COVID treated? Dr. Anupama Garu actually went over with this. As you all know, there is no FDA approved medication at this time. A lot of people are hearing about some of these medications like hydroxychloroquine, chloroquine. And there are also people who have especially rheumatoid arthritis, lupus. People have been on these medications. And for us, like manaki, malaria ki hydroxychloroquine is available in India. So please don't, go forward and just treat on your own, like taking hydroxychloroquine or chloroquine, because it's readily available for you. Please don't do that, because these medications have a lot of side effects and it's not recommended to take. These are used at this time only in the hospital setting, only for certain group of people who are very sick. Because don't get into trouble by taking these medications. And I just want to cover one slide on this, because we are hearing about this in the news recently. The surprising thing I heard in the news yesterday was because the poison control is also getting a lot of calls after these things come in the news. So as you know, there is no such a thing like Clorox chewables or injections or inhalers. So please do not do this. These are only to disinfect the surfaces. It's not meant for our body. Inhaling bleach can damage your lungs and organs, and it can also damage your skin and eyes. So even if we left, as we know, Clorox on our skin, it can give you a lot of irritation and burning. And also at this time, I would like to also mention, we are using a lot of these products nowadays than before. So please keep the out of children's reach, keep it on the, high, somewhere high, like kids don't reach, because kids are hearing these, they get curious. So be careful, keep them away from children. And I think Dr. Anupama Garu went very detailed on the vaccine, so I don't have to mention anything. So we hope and pray and we get a vaccine sooner. So the other thing I want to cover, because I'm a primary care physician, we are doing a lot of telemedicine and virtual visits now, which is actually a great thing at this time. So we are also canceling any non-essential appointments. I mean, it's recommended, like face-to-face, but you can see the doctor through the telephone or video. Unless you really need to be seen, then you speak to your primary doctor. So there are some, when you go to the, the other thing is, if you have to go to the doctor's office, try not to go with a lot of people or guests, try to go yourself and minimize the exposure to anything, go at the time of the appointment, and you can wear cloth mask. And then all the hospitals, clinics are taking a very good care at this time. When you go there, they will screen you with temperature. They will ask you the symptoms. They will ask all the screening questions. So if you have any of those positive, obviously you will be diverted to the other way. And also nursing homes, long-term care facilities and assisted living facilities. We have, these people are very high risk. As we know, when somebody is getting affected in the nursing home, it spreads so fast. And those people are very high risk, So please try not to visit nursing homes for any reason. And I think nursing homes are doing a very good job now, restricting visitors, even including their family members. So I would like to request everybody to do our part, whatever the government is doing, whatever the hospitals are doing, everybody is doing their part. So we have to do our part. There is no option. We have to slow the spread. We know the virus. We know how it transmits. We know what to prevent. And we know that it is working. When we do all the precautions, all the guidelines we are following, we know it is effective. So let's follow everything, and you follow and you educate people around you, and to stop the spread. So don't get excited. Okay, cases are going down. We can do social gatherings and stuff. Please be careful, because as we know, like in 1918 flu, even when there is not this much awareness at that time, there was a second wave and also a third wave. So we don't want to go into that stage. So it's, we had to do what we could do. So the other thing is, a lot of people getting anxious and stressed out. There is no reason to be anxious or stressed out. I know it is a different life for every single person, including the kids. We never expected like this, but we have to focus on what we are doing. Don't watch too much of the news. Don't watch also social media. There is a lot of fake news in the social media. Take care of your body, eat healthy, well-balanced meals, exercise, safely too. That's maintaining your social distance. And connect with others. This is a great time to contact with people who you have not been for a long time. Spend time with your family, your parents in India, all of these things you could do at this time. So I want to, these are the things, follow the guidelines, wash your hands, cover your mouth and face, avoid facilities. The other thing is, not only you should avoid your routine appointments, go to the virtual visits and something. Try not to go to the emergency rooms, even for other non-COVID reasons. Like suppose people are home now, they try to do some stuff. Maybe people go and want to do something on the roof, you might fall. So all those precautions you have to take, because you don't want to fall now and have a, break a bone or something and visit emergency room. This is not the time for you to visit the emergency room, including your kids. And also I tell my parents, and also in India even, take care of yourself, stay healthy, take all your medications, try not to go to the hospital for any other reasons. And thank you so much.
Thank you, Arna Garu. That was a wonderful, extensive information that you covered with a wonderful ending slide that the physicians are there at work and urging everybody to stay home and to stay safe. So Dr. Anupama Gotmukla Garu has also joined us, and we will have her talk about her specialty. Our pediatric anesthesiology our practice chestunaru medicine, and she's the vice president of API, American Association of Physicians for Indian Origin, which is based all over the nation. She has covered extensive number of webinars, and she's our guest today for TAGCA. Chala santosham. Thank you so much for joining us and giving us your valuable time. We all appreciate it. So I will give it to you, and after you finish, then we will go to the part 2 of Q&A. Anupama Garu.
Thank you, Andy. Thank you, Rupa Garu. Thank you, Satish Garu. And thanks to all the Telugu community of Greater Charlotte. Telugu English rendu kalpi maatladtanu. So I know it is for our Telugu community. Very proud of you all. and for maintaining that social distancing. So na specialty pediatric anesthesia. So nenu I want to cover some topics on COVID in children and COVID in pregnant women, and also mana elective surgeries during this recovery phase. We are in the recovery phase of the pandemic, so a little bit about that, and also association API gurinchi what we are doing for the community, adi kuda meeku I will present to you today. So it's a new disease kada andi, manamu we are learning and managing the disease right now. So oka pakka నేర్చుకుంటున్నాము, oka pakka we are implementing it. There is no perfect treatment for this disease as of now. As Anupama garu told, ఇప్పటి వరకు more than 1 million cases in US, తర్వాత more than 52,000 deaths ఉన్నాయి. So in just a matter of 1.5 months. So that's a pretty big disaster, మనందరికీ తెలుసు. So we are all trying our best to get everybody safe and healthy. So in children andi, nenu CDC website lo I got some information from the CDC website. They collected information from February 12th to April 2nd. So confirmed cases in children, 12,790 cases out of 670,000. So ante close to 1.9% anamata kids lo. So even though children lucky entante adi oka blessing anukovali manamu, less than 2% unna kuda infants are mostly hospitalized anamata ee group lo. So infants ante less than 1 year. So 95 children, less than 1 year old children were hospitalized e time period of February 12th to April 2nd. And దాంట్లో 59 kids hospitalized, తర్వాత 5 were admitted to ICU. So far in United States only 4 children died of COVID. So they are not spared. So ఇప్పుడు children లో 73% of pediatric population showed symptoms like fever, cough, shortness of breath atlaga, compared to adults lo 93% of adults have showed symptoms. So even though kids are not showing symptoms, but ఏంటంటే వాళ్ళు silent carriers గా ఉండొచ్చు, they can transmit the disease to the rest of the family members అన్నమాట, like elderly parents ఉండొచ్చు ఇంట్లో. So they are silent carriers. అందువల్ల మనం we have to be very careful with kids especially. And next thing ఏంటంటే pregnant mothers. ఇప్పుడు మన కమ్యూనిటీలో చాలా మంది ఉన్నారు కదా pregnant women. So many pregnant women may be infected, but we don't know how many are getting infected. They're very silent. Luckily, they do not have symptoms, but they are also silent, like in children. So, oka hospital New York Presbyterian Hospital, 15% were tested for COVID and pregnant women antenatal visits lo. Tarvata in Columbia University lo 1 in 8 patients were tested positive in New York. అక్కడ ఎక్కువ ఉంది కదా, సో అంటే అంత ఎక్కువ అనమాట కోవిడ్ ఇన్ ప్రెగ్నెంట్ విమెన్ లో. తర్వాత మెజారిటీ ఆఫ్ ద టైమ్ దే డు నాట్ హ్యావ్ ఎనీ సిమ్టమ్స్. అండ్ ఆల్సో మనకి ఇంకా రీసెర్చ్ ఏమీ లేదు వెదర్ ఇట్ విల్ ఎఫెక్ట్ ద ఫీటస్, అది ఇంకా మనకి ఏం తెలియదు అనమాట. అట్లాగే తర్వాత సమ్ ప్రెగ్నెంట్ విమెన్ హ్యాడ్ ప్రీటర్మ్ బర్త్స్ అండి ఈ కోవిడ్ పాజిటివ్ మదర్స్ లో. ఎందువల్ల అనేది కూడా తెలియదు, వాళ్ళకి వేరే రీజన్స్ ఉండొచ్చు, లైక్ డయాబెటీస్, హై బ్లడ్ ప్రెషర్ డ్యూరింగ్ ప్రెగ్నెన్సీ, లైక్ రిస్క్ ఫ్యాక్టర్స్. సో దే హ్యాడ్ ప్రీటర్మ్ deliveries, but they were not able to say that this is because of COVID. And also, can the babies be infected if the mother is infected at birth? So the answer is yes. So they can be infected. And also in the Seattle hospital lo newborns akkada first start ayindi kada COVID. So what they're doing is they're putting all these babies who are born to COVID positive mothers, they are putting in a separate intensive care unit in neonatology lo. Tarvata most of these pregnant women, the doctors are doing the telemedicine, and you can call your doctor, you don't have to go to the office anamata. You call your doctor and they'll schedule a visit for you. Most of the times they're doing telemedicine or telehealth. అండ్ తర్వాత డెలివరీస్ కి వస్తారు కదా ఈ కోవిడ్ పాజిటివ్ మదర్స్. అప్పుడు వాళ్ళకి అంటే నేను ఓబీ కూడా ప్రాక్టీస్ చేస్తాను ఫర్ ఆబ్స్టెట్రిక్స్ ఆల్సో. సో ఐ డూ a lot of epidurals in these patients. So we take every precaution we take and like we wear the mask, gown and the it's not contraindicated to have a epidural or anything or any C-section also. But as a physician, we take every precaution that we don't carry the virus to others, and also every staff is prepared on that. So tarvata in breast milk, the virus has not been found in the breast milk. So mothers can feed the babies during this infection time, but they have to follow the precautions, like they have to wear a mask and they have to have a screen in between the baby and the mother, and also hand washing. Mothers have to wash hands. Precautions and తీసుకోవాలి mothers. They're not telling not to breastfeed the babies. ఈ కంట్రీలో మనకిలాగా హెల్ప్ ఉంది కదా, మనకి మదర్స్ వస్తారు ఇండియా నుంచి. సో వీ హ్యావ్ లాట్ ఆఫ్ ఫ్యామిలీ హెల్ప్ అండి, కనీసం ఇక్కడ వాళ్ళకి అంత హెల్ప్ లేదు. సో దే టేక్ కేర్ ఆఫ్ దేర్ ఓన్ బేబీస్. సో దట్స్ ద ప్రికాషన్స్ దే ఆర్ గివెన్. For our Indian community, we have our parents are there, so they can take care of the babies. You can pump the breast milk and they can feed with bottles and all. So we have that help, at least we are glad. తర్వాత ఈ ప్రెగ్నెంట్ విమెన్ లో యూనివర్సిటీ ఆఫ్ కాలిఫోర్నియా శాన్ ఫ్రాన్సిస్కో దే హ్యావ్ క్రియేటెడ్ ఏ నేషన్ వైడ్ రిజిస్ట్రీ, ప్రెగ్నెన్సీ రిజిస్ట్రీ, టు track the effects of COVID-19 on pregnant women and their newborns. So already more than 1,000 people are registered in that study. And tarvata ee registry vallu they will track the women and their babies from the early pregnancy, confirm ayinappadi nunchi oka year postpartum, after delivery postpartum ante they will follow up whoever is registered in this registry anamata. Tarvata when you get admitted, like suppose you're in labor and you're getting admitted to the hospital for delivery, they are allowing only one visitor per family for the patient. Visitors are not allowed in the hospitals right now because we don't want to spread the infection to others and our family members. The third topic I want to cover is elective surgeries. ఇప్పుడు ఇంకా షార్లెట్ ఏరియాలో ఇంకా దే హ్యావ్ నాట్ స్టార్టెడ్. సమ్ స్టేట్స్ హ్యావ్ ఆల్రెడీ స్టార్టెడ్ ఎలెక్టివ్ సర్జరీస్. మా స్టేట్ నేను టెక్సస్ స్టేట్, సో ఇక్కడ ఆల్రెడీ వీ హ్యావ్ స్టార్టెడ్ అండి ఎలెక్టివ్ ప్రొసీజర్స్, అండ్ వీఆర్ గోయింగ్ ఆన్ కేస్ బై కేస్ అనమాట. అంటే who needs urgent, we have 3 kind of color codes for that. సో రెడ్, yellow అండ్ గ్రీన్. సో రెడ్ ఏంటంటే వితిన్ 2 weeks వాళ్ళకి సర్జరీ అవ్వాలి, సో వాళ్ళని రెడ్ జోన్ లో పెట్టాము. తర్వాత yellow ఏంటంటే 1 month వరకు దే కెన్ వెయిట్ ఫర్ 1 month ఈ సర్జరీ. ఆ తర్వాత గ్రీన్ అనమాట. సో గ్రీన్ వాళ్ళు దే కెన్ వెయిట్ 4 months or 6 months అట్లా అనమాట. సో లైక్ నీ ప్లేసెన్స్ అట్లాంటి వాళ్ళకి దే కెన్ వెయిట్ another 6 months. There's no rush. So in kids we can't wait that long. Our kids are growing, they have multiple issues, and so we kind of have this red, yellow and green zones. So based on the urgency, we are doing the surgeries right now. So ప్రతి పేషెంట్ హాస్పిటల్కి సర్జరీకి వచ్చిన వాళ్ళకి మేము టెస్ట్ చేస్తున్నాము, PCR టెస్ట్ కానీ యాంటీబాడీ టెస్ట్ కానీ, వన్ ఆఫ్ దెమ్. సో యాంటీబాడీస్ లో 2 రకాల యాంటీబాడీస్ ఉంటాయి, IgM, IgG. సో IgM పాజిటివ్ ఉన్న వాళ్ళకి వీఆర్ డూయింగ్ PCR టెస్ట్ మా హాస్పిటల్లో. కొన్ని హాస్పిటల్స్ లో దే ఆర్ డూయింగ్ బిఫోర్ PCR టెస్ట్. PCR టెస్ట్ నెగిటివ్ వచ్చిందంటే యూ కెన్ రూల్ అవుట్ దెర్ ఈస్ నో ఇన్ఫెక్షన్. బట్ IgM పాజిటివ్ ఉందంటే దట్ మీన్స్ దే ఆర్ స్టిల్ హ్యావింగ్ ఇన్ఫెక్షన్, యాక్టివ్ ఇన్ఫెక్షన్. సో వీఆర్ డూయింగ్ PCR అగైన్ అండ్ దెన్ వీఆర్ క్యాన్సిలింగ్ దట్ సర్జరీ. For those who have only IgG antibody test positive, we can go ahead and do surgery on those kids. And మేము కూడా, though the tests are negative for these surgeries, we still wear our N95 mask, gown, double gloves. So prati case ki we wear all the protective equipment. So we don't want to give any minute chance that they get infection from us or we get infected in this process. So about the surgeries in the current COVID ending. So then I'm going to talk more about the RP, and the RP is American Association of Physicians of Indian Origin, and I'm Vice President. We are doing a multitude of activities. Satish garu slide pettara let name betana. I can.
Yeah.
Oh.
Sharing the slide.
I want to share one slide with all of you, Andy. You can get this information on this slide. Every one of you get an email from Satish Garu or Rupa Garu. A very important information. It will be very helpful for all of you. Go ahead, put the slide. So RP, what we are doing is we want to help our community. So free refill prescriptions. Maku Indian Embassy nunchi we got a request to help parents who are stranded in US right now. They cannot go to India because no travel right now. So their prescriptions are almost getting finished because vallu 6 months, 1 year ayundochu US kochi. So they don't have any more refills on water. So they need prescriptions. So that's why we are helping them. This is a voluntary service by our physicians. Every state lo maku physician volunteers unnaru. And if you email that email which is shown on the slide, email ki meeru email cheste, one of the physician will reach you, and mee phone number kuda iste dantlo our physician will reach you and they will give you a free refill for the prescription, and also they will connect you to your nearest pharmacy. Mee nearest pharmacy వాళ్ళకి prescription వెళ్తుంది. దానివల్ల మీరు you can refill the prescriptions and do not panic at this time. తర్వాత ఇంకొకటి ఆపి is also doing a telemedicine ఒకటి క్యాప్స్టోన్ అని ఒక కంపెనీ, వాళ్ళతో మేము పార్ట్నర్ అయ్యాము. వాళ్ళు మంత్లీ ఒక $15 చార్జ్ చేస్తారు అంతే ఒక టెలిమెడిసిన్ విజిట్. సో యూ కెన్ ఆల్సో డూ ఫర్ నాన్ కోవిడ్ రిలేటెడ్ also. So because our parents may not have insurance right now, they may have finished whatever 6 months or 3 months insurance they took. So this is one way we are helping the parents. So they can log into that capstone, the link which is shown here on this slide, and sign up for that. And RP has a special discount, RP and code and what are the AAPI. If you apply that code, you will get additional 15% discount. So it may cost around $12 to $15, less than $15 per month. So make any months any months you can sign up for this. So it's very helpful for parents or uninsured, and ఎవరైనా uninsured మీకు ఇండియన్సే కాదు నాన్ ఇండియన్స్ అయినా పర్వాలేదు, you can help with this, take help with this. తర్వాత థర్డ్ ఇంకొకటి ఏంటంటే ఇప్పుడు లాట్ ఆఫ్ మీరు వింటున్నారు కదా న్యూస్ లో, లైక్ లాట్ ఆఫ్ పేషెంట్స్ ఆర్ అడ్మిటెడ్ ఇన్ ద హాస్పిటల్ రైట్ నౌ, అండ్ ప్లాస్మా వల్ల ఇదొక థెరపీ రైట్ నౌ, అండ్ విత్ ప్లాస్మా దే హ్యావ్ యాంటీబాడీస్, సో ఇట్ కెన్ హెల్ప్ ఇన్ దీస్ కోవిడ్ పేషెంట్స్ హు ఆర్ ఇన్ ద ICU right now. So RP is with this email, it's helping the donors, connecting the donors to the recipients. So ఒక డోనర్ దే కమ్ టు డొనేట్ ద ప్లాస్మా. దానికి కొన్ని క్రైటీరియా ఉంటాయి అన్నమాట. సో 2 weeks తర్వాత డొనేట్ చేయొచ్చు వన్స్ కమ్ బ్యాక్ టు నార్మల్. అంటే ఇప్పుడు డే 1 లో మీకు ఇన్ఫెక్షన్ వస్తే 28th డే తర్వాత యూ కెన్ డొనేట్ యువర్ ప్లాస్మా. So you can help others and you can help another patient who is dying. You can donate your plasma and they can receive the plasma. It has to be the blood group match plasma blood group. So that is what RP is doing, and you all can take help. And I'm always there to help you all. You can connect to me through Rupa Garu and Satish Garu. And thanks a lot, and please stay safe and let us get out of this pandemic soon. Thanks, Andy.
Thank you, Anupama Garu. That was wonderful information that you shared with us. Last slide lo మీరు షేర్ చేసిన ఇన్ఫర్మేషన్ అందరికీ విజ్ఞప్తి ఏంటంటే, this is a voluntary service that they are providing, and this Zoom call will later be shared, so you can go through that slide. If anyone is wishing to see the slide, we can forward that to you. and towards parents and everybody who is visiting here and stuck in the US. That's definitely very, very beneficial. Thank you both to your organization and you. And now ఇప్పుడు రెండో భాగానికి వచ్చున్నాము. మొదటి భాగంలో మన వైద్యులు ముగ్గురు ఆ టాపిక్స్ అన్ని వారి వారి స్పెషాలిటీస్ లో కవర్ చేస్తున్నారండి. ఇప్పుడు now we will go to the second half, that is రెండో భాగంలో I think చాలా మంది already questions chat loni, as well as if you want to text it 980-213-8240 980-213-8240 ఇది TAGCA phone line. మీరు you can text your question. కొంతమంది మాకు స్క్రీన్ మీద రావడం ఇష్టం లేదండి, లేకపోతే అడగడం మేము మామూలుగా టెక్స్ట్ చేస్తే మీరు అడుగుతారా అన్నారు. ఎస్, యు మోస్ట్ వెల్కమ్ టు టెక్స్ట్ ద క్వశ్చన్, అండ్ యాజ్ పర్ ద స్పెషాలిటీ ద ఫిజిషియన్స్ విల్ ఆన్సర్. And I urge all of you to stay towards the end. If we have Samayabhavam Bhatti, we will try to play a video that has been compiled by TAGCA on the physicians, their families, the attendees, and real feedback. So, ఇప్పుడు ప్రశ్నలు జవాబులు అన్న భాగానికి I'm opening it up. Satish garu, do we have any callers? కాలర్స్ ఎవరైనా ఉంటే రైజ్ హ్యాండ్ అని ఒక బటన్ ఉంటుందండి, అది ప్రెస్ చేయండి. ఇఫ్ యూ హిట్ దట్, దెన్ వీ విల్ సీ యువర్ నేమ్ అండ్ వీ విల్ ఓపెన్ యూ అప్ అండ్ అన్మ్యూట్ యూ సో యూ కెన్ ఆస్క్ యువర్ క్వశ్చన్.
కాలర్ ఉన్నారండి, సంఘమిత్ర. ఒక్క నిమిషం అన్మ్యూట్ చేస్తాను.
So we have a caller, Sangamitra Kotagiri. You are unmuted. Go ahead, Amma. Ask your question.
Hi, thank you for taking your time and helping us. We have a lot of questions. So one of my question is, how do we boost our immunity? It looks like everybody, somebody you know or somebody from your family is at some point is going to face this virus. So how do we boost our immunity? Like for us and the kids, how do we fight this?
Sure, I can take this question. So I don't think there's any proven therapies to boost your immunity, but in general, the ways you would want to boost your immunity is to improve your micronutrients in your diet. Vitamin C has been shown to be helpful for like common viruses like cold and things like that. It has not been proven for COVID-19, but I think if it is not harmful, it is reasonable to take food which is rich in vitamin C. And also exercise is the other one which helps build immune system. And I think in general, following a healthy lifestyle and exercise regularly will help increase your immunity. I don't think there's a specific therapy as such which has been proven to be effective specifically against COVID-19.
Okay, thank you. I think I have another one. If can I ask another question? Or?
Go ahead, you can ask the question.
We hear a lot about we're hearing a lot about people who've already experienced this back in January, and they have the same symptoms, but they didn't know if it was COVID or flu or the exact symptoms like pneumonia and everything. So how do we know whether I've read somewhere the tests are being developed. So how soon can we be tested? Like, can somebody with those symptoms back in January be tested to see if they already have the virus?
So again, it depends. That was the serology test which I was talking about, which could kind of tell you if you have been exposed and have developed antibodies to it. But it's not widely available in all states right now. Most hospitals are trying to get it, and there is some studies going for antibody, like for testing populations and things like that. Now, again, if you feel like you have gotten the disease and you are interested in trying to help somebody else, again, the plasma therapy, when you go to your blood banks, they will test you for that, for your antibodies, and you'll be able to know if you're immune or not to that also.
Okay, that helps. Thank you, Anupama.
Thank you, Sangamitra garu. Thank you, Anupama garu, for answering that question. I have one question on text, Andy. The person who has sent this, the name has come as Challa. The question is, I am due. I think she's pregnant and she's due next month. So I'm reframing her question. Pregnancy lo epidural or spinal block తీసుకుంటే ఎలా చేస్తారు? కోవిడ్ నుంచి ప్రొటెక్ట్ ఎలా చేస్తారు? మీనింగ్ వాట్ PPE will they be using because of the aerosolization and so many things that we are hearing. My parents are visiting, so I am really worried about how I will be able to protect the baby and myself in case I need to be taking epidural or spinal block.
I can answer that question, Andy. So I do labor anesthesia also. So I do epidurals in these patients. So as when you come for your delivery, they will admit you and they'll put you in the antenatal unit. అక్కడ మీరు ఓన్లీ వన్ విజిటర్, ఓన్లీ వన్ పర్సన్ అలౌ చేస్తారు. యూ కెనాట్ హ్యావ్ ఆల్ యువర్ ఫ్యామిలీ కమ్ టు ద హాస్పిటల్ ఎట్ దిస్ టైమ్, అన్ఫార్చునేట్లీ. సెకండ్ థింగ్, ఎనస్థీషియాలో మీకు లేబర్ ఎపిడ్యూరల్, దే విల్ పుట్ ద ఎపిడ్యూరల్. వీ టేక్ ఎవ్రీ ప్రికాషన్ అండి. నేను ఫిజిషియన్గా ఐ విల్ ఆల్సో పుట్ everything, like I have an N95 mask, I have another mask on top of that N95 mask, I put a face shield also, like I have 3 layers on me, and I wear a sterile gown, I have 2 double gloves, I have sterile glove. Tarvata preparation meeku epidural ichetapudu kuda we put everything clean and sterile. Everything is done very sterile. As usual we do always that, but ఇప్పుడు ఇంకా ట్రిపుల్ ప్రికాషన్స్ అన్నమాట. ఇంకా నార్మల్గా తీసుకునే ప్రికాషన్స్ కన్నా రూమ్లో ఉన్న వాళ్ళు కూడా అందరూ మాస్క్ పెట్టుకోవాలి, ఇంక్లూడింగ్ యూ అండ్ యువర్ పేరెంట్, వన్ ఆఫ్ యువర్ హస్బెండ్, అండ్ ద నర్స్ హూ ఇస్ ఆల్సో హెల్పింగ్ మీ వెన్ ఐ డూ ద ఎపిడ్యూరల్. నర్స్ కూడా అన్ని వేసుకోవాలి, గౌను, మాస్క్ అంతా. సో ఇక్కడ ఒకరి నుంచి ఒకరికి ఇన్ఫెక్షన్ రాకూడదు. యు ఆర్ ఎ నార్మల్ పర్సన్ దేర్, I'm also a normal person there, the nurse also is a normal person there, but evaram carrier o teliyadu kada, andukani we have to take all these precautions and follow these precautions very strictly. Suppose oka labor epidural by chance meeru C section ki ellalankondi, అక్కడ కూడా మేము we prepare the whole room for COVID. ఎట్లా పాజిటివ్ పేషెంట్ ఎలా వస్తారో ఎంత ప్రిపరేషన్ కావాలో అంత ప్రిపరేషన్ మేము we are prepared for that also. మాకు అంటే డాక్టర్స్ కి ఇప్పుడైతే ప్రొటెక్టివ్ ఎక్విప్మెంట్ సఫిషియెంట్ గా ఉన్నాయి. N95 మాస్క్స్ కానీ ఏవైనా, we don't have any deficiency in those, so there is no compromise for you అండి. అండ్ మీ బేబీ డెలివరీ అయ్యాక కూడా మీకు కంపల్సరీ టెస్ట్ చేస్తారు, కోవిడ్ టెస్ట్. ఈవెన్ ఇఫ్ యు ఆర్ నెగటివ్ ఆల్సో you will get tested for the COVID, make sure it is negative. And negative doesn't mean also like, PCR test negative until you can rule out the COVID in you. But if there is anything like IgM or nenu indak cheppinattuga, appudu we have to take care everything, every precaution, prepare you like you are a COVID positive patient. Hope not, and wish you very best, Andy.
Thank you, Anupama garu. I think it is a testing time for people who
But
are
not to
pregnant.
panic. Yeah, do not panic. మీరు మామూలుగా ఎలా ప్రిపేర్డ్ గా వస్తారో అలాగే రండి, ఏం పానిక్ అవ్వద్దు, ఎవ్రీథింగ్ విల్ బి ఫైన్.
I would like to add a little bit thing, Andy. Maybe the caller can be happy or satisfied with this. I will tell my own experience. I had to take my son to the dentist office recently because I was holding on for 3 weeks. So he was having some discomfort. So I made sure, what precautions they are taking. And when I went there, I was really impressed. They're not letting any parents come into the building. They come to the car and take the kid into, and there is no secretaries. I mean, there are no nurses, only the doctor is coming directly, and he has N95. So I think at this time we are better with PPE and the mask. So all the healthcare facilities, doctors' offices, I think they are doing every precaution not to give to the patients.
Yeah, నేను కూడా ఒక 2 days back I had my room was a dental room అండి. So kids come for dental procedures under anesthesia. So I did anesthesia 2 days back for 5 kids. So we took every precaution and also, yeah.
That's wonderful to hear, doctors. It's a very testing time. Andarki bhayandolanlu ekku kalugutunnayi, especially for pregnant women and people who have small children, how it affects them and what will happen. So thank you for answering that. And I think we have a caller. Anybody who has raised their hand, Satish garu?
Yeah, we have a caller, Anu Pannamandi. Let me unmute.
Oh. Anu Pannam garu, you are unmuted. మీ ప్రశ్న అడగండి.
నమస్తే అండి. థ్యాంక్ యూ టిఏజీ సార్, చాలా బాగుంది వెబినార్. సో నా క్వశ్చన్ వచ్చి, ఇది ఇంతకు ముందు అడిగారో ఎవరన్నా తెలీదు. అందరూ ఎలాంటి జాగ్రత్తలు తీసుకోవాలి కోవిడ్కి అలా చెప్తున్నారు కదా. ఒక ఫ్రెండ్ ఇండియా నుంచి కొంచెం టెన్షన్ పడుతుంది కనుక కోవిడ్ వచ్చేసిందేమో అని. అలా వచ్చేసినప్పుడు వాళ్ళు పానిక్ అయిపోయి స్ట్రెస్ అయిపోయి అలా చేస్తారు కదా, వాళ్ళకి మీరు ఎటువంటి జాగ్రత్తలు చెప్తారు? ఎలా ఎంత ధైర్యంగా ఉండాలి, ఏం చేయాలి, దాని నుంచి ఎలా బయటపడాలి?
So I can answer this, Andy. And one of the slide I wanted to stress out is like, a lot of people, I'm also getting a lot of calls, not only from my patients, but also from friends. So it's understandable totally, the thing that we are going through, we have never experienced before. It's quite common to get anxious and to get a little bit stressed out, but there is no reason to get anxious. In fact, we have to be cautious, but there is no reason to be anxious. So if you have any symptoms, you call your provider. As we said before, all the symptoms that we are talking, it doesn't need to be COVID-19. All the patients who have COVID-19, 80% of the people do not need any treatment. They can stay home. So those are the positive things. Even though the transmission is there, it spreads so fast. And, some of for certain high risk people, it's very dangerous. But, maintain, don't watch TV. That's what I mentioned before. Think positively, and, stay healthy. Try to do the things that makes you feel better. That's what I would advise.
Thank you, Andy. That was Anupanam garu, మీ క్వశ్చన్ ఆన్సర్ అయిందా?
యా అయిందండి. థ్యాంక్ యూ.
Thank you. So do we have a question on chat, Satish garu?
One more caller, Andy.
Go ahead.
Krishnaveni, one second, let me unmute. Krishnaveni garu, you're unmuted, Andy.
Hello, Andy. Yeah, this is Krishna from California. మీరు కాన్వల్సెంట్ థెరపీ గురించి మాట్లాడారు కదండి. Could you please elaborate a bit more about it in Telugu?
So I can take that. So convalescent therapy anedi passive transfer of antibodies to the person who is sick anamata. So evaranna if they have had symptoms of COVID and they think that they might have had COVID and they have recovered from it, that is 2 weeks at least has passed since they have completely not had symptoms and their symptoms have resolved completely, then you could potentially go to a blood bank and to see if you are eligible for convalescent serum testing. So the FDA has approved convalescent serum only for certain criteria. It should be only for those who are very severe disease and meet some criteria that they can get that therapy on a investigational drug basis. But konni small case series lo it has been shown that 70% of patients who have received this convalescent sera have improved when other treatment have not worked any. So anduku there has been a huge push for people to donate if possible if they are eligible. Again, there's a lot of things which need to be screened for that. It depends on the blood type of the person, and they also screen for other infectious diseases and things like that before making sure that the convalescent sera is available. Does that help your question, Alice?
Oh, yes. Thanks, Andy. Thank you.
We have one more caller, Andy. Sai Kauri garu. Okay, let me unmute. Sai, మీరు unmuted అండి.
Okay. A few weeks ago, there was a news kadandi. US is going to see the peak in COVID deaths and చెప్పి. My question is specific to North Carolina అండి. Have we reached the peak in NC అండి? And also, how do you know that we are at peak? And because I see that dates are keep changing, that peak dates are.
So basically, there's a lot of modeling studies out there which determine whether we have reached peak or not. Again, modeling studies takes into account number of tests positive, number of symptoms, patients with symptoms of ILI and all of that, and a lot of mathematical things which go into modeling. And usually there's a huge variation in the in the numbers which are put out. So as the numbers, like 1 month ago, you must have heard that the number of deaths which was predicted was really high. But again, there was a lot of social distancing which occurred after that, which helps reduce some of that. So specifically for North Carolina, the peak now is supposed to be at the end of May or the first week of June. And even then, we are not sure that we will truly have a peak, or we are in a plateau curve. So we might not even see that peak, which is a good thing for us and our hospitals, which won't be overwhelmed.
అండ్ ఆల్సో నిన్న మార్నింగ్ ఎన్పిఆర్లో న్యూస్ వచ్చిందండి. అదేంటంటే ఇది May 11th is the date that it's safe to ease the social distancing restrictions అని చెప్పి న్యూస్ వచ్చింది. May 11th is the date for North Carolina అని చెప్పి.
So there has been some general outlines by the White House, and every state will, again, based on syndromic surveillance అనేది చేస్తారు, where basically any patient who comes to the ED, they look at symptoms of influenza-like illness, and that is something which all states mostly, they do that on a routine basis. So ఇప్పుడు ఈ COVID test availability, number of positive tests. So ivanni together, they'll put it together and they'll kind of determine when they can start relaxing the situation a little bit. And as we said, again, phased approach lo avali, and they will kind of determine what is most essential first and try to relax it in a phased approach. And once they do that, they will wait for 1 to 2 incubation periods to see if there is an increase, what that has done. Will that increase your number of cases or your number of influenza-like illness cases? And then based on that, they will determine if they can relax further or you would need to continue to social distance. So all that is very closely looked at, and based on those, some governmental decisions have been going.
Okay, thank you.
We have a chat question, Andy. This question is from Rajini Kondal. It's a two-part question, and I'll ask the first question. Is virus spread through eyes? If yes, do we have to wear eyewear when in public?
Yes, the virus does spread through the eye. You can get conjunctivitis from COVID-19, and typically the way that is spread is when you have contaminated virus on your hands and you touch your hands with unwashed hands. Again, you don't have to wear eyewear in public on a routine basis. You would want to make sure that whenever you're touching your eyes, that you have clean hands before you do that. Again, eyewear is very essential for healthcare workers, where you expect some sort of aerosols or droplets or something spraying into your eyes. Again, for the general public, when you're social distancing and you're 6 feet apart, you shouldn't be coming into that situation. So for us, for the general public, I think the most important thing is to make sure that you're not touching your eyes after touching your nose or touching other objects which could be potentially contaminated.
The second question today, I am a dentist. I mean, actually, Dr. Rajini Kondagaru, she's a dentist. I'm planning to buy extra oral suction system for aerosol suctioning, which suctions only up to 0.3 microns, but COVID is 0.012 micron. Question here is, does COVID-19 spread only via aerosol? If there is no aerosol, COVID-19 in itself cannot infect, correct?
So again, Andy, the main way of spread of COVID-19 is droplets, but there is an NEJM article which came out which said that it can be spread to aerosols too. But that specific study, basically, it put the virus in artificial chambers, which causes aerosolizing. So it wasn't clinical situations where regular cough or things like that can cause. So the thought is that those were powerful machines, and again, it's not as potent as what we see on a clinical routine basis. So again, the chance of spread to aerosolization is really low. So if your specific equipment, if it's a closed system and it's not really generating aerosols, I think it is fine. But if you feel like it is not a closed system and it is generating aerosols, then you would need to wear N95 for protection against COVID. Does that help your question, Anda?
Yes.
I think it does, Anupama garu. That was a wonderful answer. Now we see that in the webinars, even physicians are having some questions when they see that, people from other specialties can answer and give their perspective. That's a wonderful thing to see. Satish Garu, I have one question on text on anesthesiology. That is, I'm framing the question. She has sent it in 2 parts. Do you recommend parents not in the house for 2 weeks, as the mother could be carrier in hospital once they arrive home? And parents are not in the hospital. I think this is for hospitals that are not allowing the parents to come in. So the second part is of the question is that, you know, they're due to have a baby next month. Ma ammagaru India nunchi vachunnaru to help me, but my mom is 60 years old. I'm worried if she can be with the baby in hospital, and if yes or no, I don't know. And then when we come home, what should I do to protect both? I'm anxious about this, as I have heard a lot of news that, you know, older people are at high risk, and children are also testing positive for COVID. Can you shed some light?
యా నేను ఆన్సర్ చేస్తాను. ఏంటంటే ఇప్పుడు షీ వన్ విజిటర్ కదా, ఇదర్ హర్ మామ్ ఆర్ హస్బెండ్ కెన్ స్టే ఇన్ ద హాస్పిటల్ వెన్ షీ గోస్ టు ద హాస్పిటల్. సో మళ్ళీ వాళ్ళు డెలివరీ అయ్యాక ఇంటికి వస్తారు కదా, ఇంటికి వచ్చినప్పుడు యూ డోంట్ నో, యూ మైట్ హ్యావ్ గాట్ ద కోవిడ్ ఫ్రమ్ సమ్ నర్సెస్ ఆర్ సంబడి హూ ఇస్ ఇన్ ద క్యారియర్ స్టేట్. సో అందువల్ల ఇంటికి వచ్చే ముందు యాక్చువల్గా hospital, they are testing very frequently all these OB patients. They want to make sure they did not get the disease in the process. So they may do daily testing, or they may do one test before admission, one test in the middle, one test at the end. So it's liberally available. This testing is available now. That's not a problem now. So before they go home, maybe they'll get tested before they leave. అదొకటి. తర్వాత సో ఇంకా డౌట్ ఉంటే ఇంటికి వచ్చాక ఐసోలేట్ చేసుకోవడం బెటరే. మదర్కి యూనో షీ నీడ్స్ ఐసోలేషన్ ఫర్ 2 weeks డెఫినెట్లీ. ఆ ప్రికాషన్స్ తీసుకోవాలి. ఇంట్లో కూడా అందరూ మాస్క్ పెట్టుకోవాలి వెన్ యూఆర్ టాకింగ్ టు ఈచ్ అదర్. అండ్ బేబీకి ఎస్పెషలీ బ్రెస్ట్ మిల్క్ ఈజ్ నాట్ కాంట్రాఇండికేటెడ్ కాబట్టి యూనో యూ కెన్ breast pump ఉంటే కదా, యూ కెన్ గెట్ ద బాటిల్స్ అండ్ దెన్ ఫీడ్ ద బేబీ సపరేట్లీ పేరెంట్స్. తర్వాత మదర్ యాంగ్షియస్ ఉందంటున్నారు కాబట్టి ఇన్ హౌస్ మదర్ లెట్ హర్ నాట్ గెట్ ఎక్స్పోజ్ టు ద డాటర్ హూ డెలివర్డ్ జస్ట్ నౌ. 2 weeks కొంచెం సపరేట్ చేసుకుంటే దెన్ ఐ థింక్ ఎవ్రీబడి విల్ బీ సేఫ్. ఆ డౌట్ కూడా ఉండదు మనకి. I know it's a hard time. It's a stressful time for anyone to deliver a baby at this time, but without panicking, manam oka 2 weeks e kada idi process, so you have to take care all the precautions and at home gani hospital lo unnappudu kuda always put a mask on. And nurses also taking extremely good care right now for OB patients, and so they don't want any chance for the baby and the mother, because there are 2 lives here, so we take extreme precautions. So not to fear, not to worry. So whatever you want to do at home, you can do. Mother, elderly parents can stay away for 2 weeks from you, and then they can take care of the baby remotely in the another room, and have your room and your bathroom and everything for you separately.
Thank you, Anupama Garu. I think that
Anupama Garu, question lo, is she asking like mother going to the hospital when the pregnant lady is in the hospital? I think
they delivery appudu అమ్మగారు షీ 60 years old అంట, ఇండియా నుంచి వచ్చున్నారు. సో డెలివరీకి వెళ్ళాలి కదా హాస్పిటల్ కి, అలౌ చేస్తారో లేదో తెలియదు. సో ఒకవేళ అలౌ చేస్తే అక్కడికి వచ్చిన తర్వాత 60 and above వాళ్ళకి ఇట్ ఈస్ మోర్ రిస్కీ అని వింటున్నాను. ఐఎమ్ హియరింగ్ a lot of things. So once you have the baby and my mother comes home, she can contract it or the baby can get it. ఆ మీమామ్స్ లో అడిగిందమ్మా.
Right. I think mother will be at high risk if she is more than 60. So it's better to avoid her to go to the hospital those 4 days when the mother is in, when the pregnant lady is in the hospital. As Dr. Anupama Garu said, when she comes back home, all the precautions the elderly mother can take. But because she is a high risk, I think it's better to avoid her going to the hospital, whatever the day she is in the hospital. If her husband is healthy, relatively will be low risk. So, it's better that way, I think.
ఐమ్ ష్యూర్ నార్మల్ డెలివరీ అయితే వాళ్ళు రెండో రోజు థర్డ్ డేనో ఇంటికి పంపించేస్తారు. సో
Wonderful. Thank you, ladies. And I think we have a caller, Satish Garu.
Yeah, we have a caller, Shekhar Bulina. Just let me unmute. Shekhar Garu, you're unmuted.
You're unmuted. Please ask your question.
Hi, thanks, Andy. Satish Garu. Can you hear me?
Yes, sir.
Just have a quick question, Andy. These days, I hear people, who are physicians, and one of my family friend from Louisiana was affected, and he didn't have any symptoms. So basic question is, people are, and he went himself and got tested, and he found out that, he was positive. So my question is, can this affect even without symptoms? That's all. Thanks.
Yes, Sandy. So there can be asymptomatic transmission, and some people may be asymptomatic when they have when they test positive too. Again, 80% of patients have mild symptoms. Of them, a few of them could have no symptoms but just test positive. That is possible.
So in this case, you advise us to take a test even though we don't have any symptoms?
So no, I think there are a lot of people who would be in the population who could be a carrier, is what we call, but have no symptoms. So not all of them need testing. Again, different hospital systems have different criteria, but for the most part, again, symptomatic patients are the one who they are testing, and some cases, again, like pre-surgery and other, if they're going to a congregate setting like nursing homes and things like that, are where they are making sure they test even asymptomatic people. So for us, I think for the general public, it doesn't change our status to test everybody. So again, you would want to wear a mask when you go out so that none of your secretions, in case you are a carrier, goes out to and prevents spread from those secretions going to anybody else. And that would help, but it's not currently universally tested in the community. There are some populations where they have done that, and that is more just to get prevalence of the number of infected people available, but it's not done on a routine basis populations testing.
Yeah, the reason why I was asking is one of my friend who was supposed to be a VIP patient who had undergone an organ transplant wrote an email for his doctor asking, if he has to get tested, but the response was a no from the hospital. And just to bring awareness, and since we have 3 physicians on the call, I just wanted to get your perspective. Thank you.
Thank you.
Thank you, Shekhar Garu, for your very pertinent question on COVID, and thank you, Anupama Garu. I think we have another caller already. So as we are nearing 4:40, we will take callers back to back. Go ahead. We have one more caller, Kadandi, Satish Garu.
Yeah, I see Jamsheed. Jamsheed, one second.
Hello.
Jamsheed, you're unmuted.
Can you hear me, Satish Garu?
Yeah. Yes.
Yeah. Thank you, Satish Garu. Thank you, TAGC. It's good program and chala manchi information వచ్చింది. One thing, ఇక్కడ నేను ఎన్సీలో ఉంటాను. సో నాకు కరోనా వైరస్ టెస్ట్ చేయించుకోవాలంటే ఎన్సీలో పద్ధతి ఏంటి, టెస్ట్ ఎలా చేస్తారు?
So it depends on different hospital systems, Andy. If you call your provider based on there are commercial labs which are available, and again, each facility has different testing criteria. So if you are sick, definitely call your provider and they will connect you to the closest place where you can get tested. Some facilities have mobile sites, drive-through sites, where you can, once you are approved for testing, they'll give you an appointment. You actually go in your car and you get tested in your car and go home. And again, some other places, it's like they have dedicated areas where you can do testing. So it all depends on what your symptoms are and what your facility and your provider is can help get.
Okay. Thank you so much.
To the same question, Andy. Actually, I think I put it in the slide. If you don't have symptoms, Andy, you will not be eligible for testing. Like, I'm a healthcare provider. If I want to get tested with no symptoms, I cannot be tested. So I just want to make sure you understand that. So if you're having symptoms, not everybody who has symptoms needs testing. So you call your healthcare provider and they will decide whether you need testing or not. If you need testing, go to the places, drive through or to your healthcare providers' offices so you can get tested.
Sure. Thank you so much. Thank you, Satish garu.
We have one last caller, Andy. I'll unmute Kiran. Kiran garu, one second. Yeah, Kiran, you're unmuted, Andy.
Hello, Andy. Thanks to all the doctors for spending time to do these webinars and also to the TAGCA committee. And my question is, are there any known effects due to weather conditions? Like antuntaru kada ante hot ga undi weather does it kill the virus more, cold weather lo raadu ala emanna unda?
So in general, cold weather influenza season typically starts from like October up until end of March atla. And one of the reasons is that a lot of factors play a role with humidity and temperature, and also because when you're in cold weather, you have a lot of, you're not going out and there's indoor congregation. And so it tends to spread more easily when you are indoors all the time. So coronavirus is killed fairly easily by heat, but again, seasonality of this specific novel coronavirus is still not known. But looking at other respiratory pathogens, it still does seem like in winter season, probably it will be more prevalent just because of the overcrowding in indoor spaces in winter.
Okay. Thank
you.
So
you could expect a higher incidence in winter. Yes.
Thank you.
Sure. We have one question in chat from Krishna. I've been reading about boosting immunity. Does zinc supplements help? If it does, what dosage should be taken?
Yes, in general, zinc does help to boost immunity. Again, it has not been proven specifically for COVID-19. As it's part of your multivitamin, just your routine dose on that, whatever is indicated for a normal person would be enough sufficient. So again, it's not proven therapy.
Dr. Lokesh Idara garu unnaru line lo. You can unmute him.
I think we're having issues, Anupama garu, to unmute the chat callers. So if there is a question, we can read it out. We tried, Indaka we tried, Lokesh garu chusam gaani, it is not working out. I have one question. Satish garu, do you have chat or can I ask the text questions? I have a couple of them for the doctors.
I have a chat question.
Go ahead.
From Dr. Nagamala Chalsan garu. If a person gets reinfected with COVID-19, how can we explain this, as they might have already antibodies in system with prior infection before? In this scenario, is plasma therapy going to be helpful?
I can take this. So I don't think we have complete information for that as of yet. So again, when somebody gets the disease, it is positive. You will have antibodies in quite a few patients, but a few of them, antibodies do not develop. So, and even when you look at regular coronavirus, how long the immunity lasts is not really known, and you could get reinfected with different strains and things like that. We still need to see how this plays out when further mass serology tests occur, and whether plasma therapy is going to help when you become sick again. But I don't think it is known as of yet.
Thank you, Andy. I have one question. That is, Jyotsna Kallepal adigaru. So I would like to address that question. The physicians here and in all the 4 webinars that we have conducted as part of our informational webinar session, they are not available as physicians who you can call and take medical advice from. This is only part of an initiative from TAGCA to provide information. So if you have any emergencies, please call 911. And if you have any concerns, please talk to your specialty or healthcare professional that you regularly go to see. The physicians that have participated in these webinar series are mostly hospitalists, and they are unavailable to do telemedicine or to write prescriptions, call-in prescriptions, or anything of that sort. This is only for part of our Stay Home, Stay Safe campaign, where we are trying to help the public with general information and answers to general question and answers. So I hope that answers Jyotsna Garu. And Satish Garu, can I go ahead with the text question? We have to wrap it up, in the next few minutes.
Sure, yeah. I mean, there's one chat question, but you can go ahead with your. Okay.
You can ask.
Okay, so this is from Pavani. What if we have okay, I think they have an appliance repair at home and an outside contractor needs to come inside the house. What precautions do we need to take?
I can take on this. I think it's the same precautions as we are telling when we go to the public. So if you don't know the person and he's coming to your house, make sure it's better him to wear a mask. It's recommended now. And make sure, you don't touch any places that he touched, the surfaces and stuff, and hand washing. These are the general precautions you have to follow.
Okay. Thank you. And I will do two last questions that we already have on text. Anupama Gotimukla garki oka question undi. Pavani saying thank you to all the physicians and your answer. Anupama Garu, for you the question is, as you are seeing in a national scenario, do you know what is the ratio of physicians who are getting infected?
In US lo inka statistics ledu manki. We don't know how many physicians are being infected only. So maybe maybe in a month or so, probably we'll get some data about how many physicians have been infected in this process. But unofficial, there is a talk that almost 15%, 50% are infected. So we don't know yet. So
yeah. So I think she's a physician's wife, the one who asked.
Yeah,
one of the
physicians. There are a few physicians who died also. There are some who are recovering in ICUs. There are some at home. So, but we do not know exactly. In ippadi like AMA gani, CDC gani, they did not release any data how many physicians have been infected so far. So, yeah.
Okay. Then thank you, Andy. Satish Garu, was Nagmala Garu's question attended? Like she texted a question.
Yes.
About a person gets reinfected with COVID-19. Yep. Yeah. Okay. If that was attended, there is two questions. We'll take it fast and then we will end this session. And one of it is, do the physicians here from Charlotte can shed some light on how many deaths in Indians in North Carolina? And they keep saying that the peak is at a certain week. It was supposed to be last week. How come it keeps changing? What affects the change of date of the peak of the COVID?
So the amount of deaths in Asians has been really low. In our county, specifically for Charlotte-Mecklenburg County, the major increase in the deaths have been in African Americans, and there has been some socioeconomic disparities and increased disease in that subpopulations, but I think Asians, it has been minority of those who have been infected. Again, the peak depends on a variety of things like syndromic surveillance. It depends on the number of cases. Our peak in Charlotte is expected to be end of May to the first week of June, and we might not have as much as a peak as we initially thought, and probably will be more like a plateau. But it would depend on how, and part of what has changed that, or why that has moved the peak, is because of the social distancing and all that hard work which everybody has done.
Okay, thank you, Andy. One last question. After this question, I urge everybody to stay. We will try to share. We are having a few technical difficulties, like on the chat. We are not able to open up Dr. Lokesh Idra garu. So as we are nearing the end of the session, we have about 10 minutes to go. I think this question one of you all can answer about a lady who has a child and they have a swimming pool in their backyard. So it seems she's 4 years old, and Kiran is asking this question, 4 years old, and she's asking why she should, mother is fearful of sending her to swim in the swimming pool, which she's used to, which is in the backyard. The child keeps asking why does not the chlorine or the bleach in the swimming pool kill the virus? But mother is fearful that as she takes in the water with her nose or with her eyes and mouth, will she get infected? And the mother is pregnant. She's 6 months pregnant.
I can answer, Andy. If the swimming pool is in their own house and nobody was in the swimming pool from outside and nobody at home are sick and the swimming pool is properly maintained, I think it's completely safe for the 4-year-old to enjoy her swimming. You know, I know the pregnant lady is high risk, but as long as there is nobody use the pool from outside and you know, nobody is sick at the home, I think it should be completely safe.
Thank you. Okay, this is the last question. Antigen based rapid testing ante enti? Telugulo simplified ga చెప్తారా? అంటే దాన్ని ఎలా కండక్ట్ చేస్తారు?
అంటే ఇప్పుడు జనరలీ ఆఫీసెస్కి వెళ్ళినప్పుడు ఫ్లూ టెస్ట్ 5 minutes లో మనకి రిజల్ట్స్ వస్తుంది కదా. సో బేసిక్లీ వెన్ యూ నోస్ లో స్వాబ్ చేసి వెన్ యూ it's a test which is like a card test which you do in the office and you get results pretty quickly. But alanti test lo there is some issues with that testing. Even when you have the disease, some percentage, depending on which test you use, 15 to 20% negative chupiyachu. So that is the disadvantage of using those kind of tests. Even though the advantage is that you will get your results very quickly, disadvantage is that even though you have a positive test, you might not show up always on that test results.
Okay. Thank you. And I think with this, mana prasnalu javablu anna session ni with about 7 minutes left, we will start winding down. And Satish garu, are we done with the chat questions? Like there are some people texting asking if they can join the webinar now, but we are already there. We have exceeded on the time.
Sure, yeah, I don't think there's any more. ఇక్కడ చాట్ లో కూడా కొన్ని టెక్నికల్ డిఫికల్టీస్ ఉన్నాయి. నేమ్స్ పాపప్ అవుతున్నాయి కానీ క్వశ్చన్ బయటికి రావట్లేదు.
Okay. So I will give it to the physicians to say a few words. In the meanwhile, I will try to share some content that has been compiled by our volunteers as owed to the physicians, their families, as well as our committee members who have worked hard to make this webinar series happen. So my video will go off for a little bit. I urge you, all three of you all, to talk while I try to share content. Go ahead.
Anupama Gottimukula again. So nenu San Antonio, but thank you Telugu Association of Greater Charlotte. Thanks to Rupa garu, Satish garu, and also from my side, being an anesthesiologist, మీకు ఏమైనా questions ఉంటే you can always text me, and I'm always available. My number is there with both of them. తర్వాత be careful and stay safe, and don't take it easy, but at the same time do not panic. Do your things when you go out, follow the precautions, and everything will be fine. Thanks.
Thank you, Andy. And now I will be sharing a video with you. It is a wonderful volunteer effort by one of our volunteers, Sri Srini Kollagaru. So, are you able to hear it?
No, Andy. It's not playing.
It is not playing.
Yeah.
We can only hear your voice.
So there is an issue with the sound. So what we will do is we will switch to our TAGCA Seva video. And this is for all the physicians and their families. And Srini garu chesina ee effort, we will post it on our Facebook and our Instagram. And we ask that a lot of people are texting me as well that they are just planning to join the webinar and they would like to see the videos. We will share them on our social handles. Please do follow us there, and there will also be a feedback video. So right now we will try to share the content and go with the TAGCA video. Are you able to hear it?
No, it's not visible. It's not visible. It's no audio. And I think there's some.
Okay.
Yeah.
Okay. Looks like there is a technical difficulty. So we will stop the share, and I would like to say a few words on behalf of TAGCA Seva. I will send all the physicians the videos that we have compiled. Unfortunately, as we are already beyond time, last few minutes we tried, but we have handled close to 136 questions in this set of series of 4 medical webinars and 1 Will and Trust webinar. These webinars are basically to cover the information and help the anxiety of people and to provide with them the information in our language. Most of you all have been very kind enough to provide us your valuable time away from your families already at work, and also a number of slides have been prepared by all of you. Adi andar tarpuna, ma karyavargam tarpuna, TAGCA Seva tarpuna, Telugu Association of Greater Charlotte Area values your time and thanks you very, very much. And I exhort all the audience to please watch our videos. There are a set of 3 which are named as Vaidyo Narayana Hari. And I will share them with you. I will give it to the doctors who have not said those few words to continue, and then we'll finish the webinar.
I would just say thank you for the opportunity for TAGCA to be a part of this, and glad to be of help. And I would say I think one of the best ways to prevent infection is to wash your hands and stay home when you're sick. And I think in this pandemic that becomes even more important. So just follow that and be safe.
నమస్కారం అండి, నేను డాక్టర్ అరుణ పెద్దిరెడ్డి. సో నాకు ఈ అవకాశం ఇచ్చిన TAGCA వారికి, ఇది ఆర్గనైజ్ చేసి చాలా సక్సెస్ఫుల్ చేసిన సతీష్ దండమూడి గారికి, రూపారాజు గారికి, అండ్ చాలా విలువైన టైం స్పెండ్ చేసిన అండ్ వెబినార్స్ లో పాల్గొన్న ఫిజిషియన్స్ అందరికి, అండ్ audience, all the audience who participated, and actually you guys asked interesting questions. We hope we answered your questions, and our webinar is helpful for you. So మీ అందరూ ఆరోగ్యంగా ఉండి సంతోషంగా ఉండి ఇవన్నీ గైడ్ లైన్స్ ఫాలో అయ్యి ఎంతో కొంత కమ్యూనిటీకి హెల్ప్ చేస్తారని భావిస్తూ నమస్కారం.
And Anupama garu, did I intrude when you were talking? Please go ahead and finish this for us. Anupama garu ento time vechinchi vere ఊరు నుంచి ఆవిడ చేస్తూ కూడా ఆవిడ time vechinchi చేశారు. From the TAGCA Charlotte community, thank you very much. Please say a few words.
So the last last thing ఏంటంటే మీకు ఆ స్లైడ్ పంపించాను కదండి. So anyone needs any help with prescriptions, please don't hesitate. Please email that one. And children especially are playing outside now. They are prone for injuries. Get everyday fractures and foreign bodies like they swallow coins and all that stuff. Children at home, button batteries, atlantis swallow chestunaru. A lot of kids are coming with those kind of issues. So please watch your kids at home and this is not the time to go to a hospital. So watch చేయండి కొంచెం దగ్గర ఉండి, also monitor them remotely what they are doing. And pregnant women, do not panic. The doctors are there to help you. ఇప్పుడు ఇంకా డబుల్ కేర్ అండి, మీకు మామూలుగా కన్నా ఇంకా ఎక్కువ కేర్ఫుల్ గా ఉంటున్నారు స్టాఫ్ కానీ. So there is no need to panic that if you go to hospital you're going to get infection or anything. But confidence on the doctors who are treating you, and will take good care of you. And thanks for the opportunity to talk to all of you.
Thank you, Anupama Garu. And we have a feedback for the president of TAGCA from Lokesh Idra Garu, that the webinar series is excellent for people as well as physicians from API. He says congratulations for providing such a noble cause at the time of this pandemic. So andariki, especially audience ki participation lekunda propagate avadu. So just as fast as the virus created a pandemic and propagated, both our frontline healthcare workers, being the physicians, as well as Telugu Association of Greater Charlotte Area in its TAGCA Seva initiative, and the audience helped spread the word. And I urge everybody to see the recording of the Zoom sessions, which we will be sharing in the emails. And for non-TAGCA members and people from outside, we are getting a lot of requests about how to watch the webinars that have been conducted. Please do follow our social media handles, both on Instagram as well as Facebook, and we will share everything that has been covered till now in that. Thank you so much. Andarki namaskaram.
Thanks. Thank you.
Thank you.
Thank you.